Hello and welcome to 72 Dragons Health. Today we had the pleasure of speaking with Dr. Michelle S. Williams. Our guest for today is actively involved in several impactful endeavors that contribute to the welfare of society. Dr. Michelle S. Williams is an associate professor in the Department of Global and Community Health at George Mason University. Dr. Williams' study focuses on reducing cancer inequalities by creating culturally relevant health behavior interventions for cancer prevention and control. Dr. Williams has been working on cervical cancer prevention studies in Ghana, West Africa, since 2009. Dr. Williams is deeply dedicated to cancer prevention and control as well as public health. She spends a lot of time volunteering for neighborhood-based organizations serving her community. She also chairs the Women's Caucus of the American Public Health Association, APHA. Welcome to this interview, Dr. Michelle S. Williams. We are honored to have you with us today.
Thank you. It's an honor to be here.
Dr. Williams, how did you research on women's health and cancer prevention help you in your role as the chair of the Women's Caucus in the American Public Health Association, APHA?
So the work that I do, especially when it's focused around cervical cancer in low and middle income countries, at the time that I started doing that, it wasn't something that was highlighted a lot. And that is actually the goal of Women's Caucus, is we highlight women's health issues that are not often discussed. And so that really helped me to understand the need to really focus on women's health issues and bring these issues to the forefront.
Can you walk us through some of your initiatives in the past year as the chair of the Women's Caucus at APHA, and what are some of the upcoming expectations for APHA 2024 in Minneapolis, Minnesota?
Oh, sure. So some of the great things that we do with the Women's Caucus, as I mentioned, we really highlight our focus on continuing the conversation about women's health issues throughout the year. At one point, our focus was really on having a wonderful program at the annual meeting. However, when I took over as chair, I really wanted to have those conversations continually going. And so we have a webinar series called Critical Issues in Women's Health. And so we have webinars about 3 to 4 times a year throughout the year that focus on different health issues. And we've already had one of those this year. We also had a book club meeting discussion where we focused on several different issues. Again, one of them, for example, we had a book that was free to the public that focused on solutions for reproductive health. And we're very fortunate to actually feature the editor and chapter authors of the book to help discuss their book and help to get that out into the public. Another fabulous thing that we did this year was we did a period product drive, and we were able to secure a number of donations. I believe the total that we raised was about enough donations to help 500 individuals who are menstruating. And we donated those products to the Grace House, which is an organization in Jackson, Mississippi that serves underserved individuals. And so those are just some of the initiatives. Before our annual meeting, we're going to have another Critical Issues in Women's Health webinar that focuses on global health issues. And we have a wonderful program that we put together for the annual meeting.
Sounds fantastic. And congratulations on becoming a tenured associate professor last year in the Department of Global and Community Health at George Mason University. Is there any particular project you are working on currently that you're most excited about?
Oh, I have so many different projects going on right now. I think the one that I'm most excited about is a project that's focused on developing a lung cancer education intervention that's targeted towards individuals in Mississippi where we have a super high rate of lung cancer mortality. And that project is being funded by the Cancer Prevention Foundation. And it's just an amazing project that I'm really excited to be finishing up this year.
Sounds exciting. Now, we have learned that you are interested in weightlifting, kickboxing, playing tennis, and traveling. How do you balance these interests with your professional and academic expectations?
Well, the weightlifting is easy to fit in. I fit that in because it's my, I guess, my stress relief. I have to do that at least 5 to 6 times a week. The traveling, unfortunately, my schedule has been super busy. I haven't had a chance to travel, but my goal is to get back to Paris by the end of the year. So it's really just making sure that I'm taking care of myself so that I can be there to do the work that I do and work with all the amazing people that I work with.
How do you think public health policies are changing regarding cancer prevention and women's health? And what more do you think needs to be done for better policymaking and implementation of these initiatives?
I do think that policy is catching up with a lot of women's health issues in regards to cancer prevention, but I still think that there's a lot that can be done in terms of increasing accessibility. One of the projects that I've been working on for several years is a project that's done by the University of Mississippi Medical Center. The Cancer Institute there, they have a program called See, Test, and Treat, where we provide free mammograms, oral cancer screenings, and cervical cancer screenings to underserved women. But I think that the policy can do a better job of making those screenings accessible more than what we offer once a year. So I think there's definitely room to grow in making these screenings a lot more accessible for women.
Dr. Michelle S. Williams, thank you for speaking with us today. It was a pleasure learning about your experiences and insights into cancer prevention and women's health. Wishing you great success at the APHA 2024 annual meeting and with all your future projects. Thank you.
Thank you.